Now, the outbreak sweeping across the cities in Zimbabwe brought back memories from the epidemic in 2008. The government had then declared a national emergency, and almost 4,000 people have died. Neighboring states, Malawi, South Africa, and Mozambique, also frequently experience cholera outbreaks, and the authorities are pleading for help in stopping the spread and providing clean water, as current relief efforts are insufficient. Now, as we navigate this crisis, it is essential to engage in meaningful conversations that will not only raise the awareness of the issue, but also promote critical thinking and potential solutions. And that's why today I will be joined by two amazing guests who will be helping us to understand the situation at hand. First joining me is Sibusiso Bhebhe, the Executive Director, Youth Zimbabwe, Bulawayo. Thank you so much for joining us, Sibusiso.
Thank you for having me on the show.
It's a pleasure. Also, we have Biata Beatrice Nyamupinga, a member of the Zimbabwe Parliament, Goromonzi West Constituency in Harare. Thank you so much, Beatrice, for also joining us.
Thank you, and thank you for inviting me.
All right, a pleasure. Now, talking about the cholera outbreak in Zimbabwe, starting with you, Sibusiso, what factors have contributed to the rapid spread of cholera in Zimbabwe?
I think the country has been battling a number of issues, mainly around issues of service delivery within the cities and in the various communities where we've seen delays in collection of refuse. We also have chronic water shortages where we can spend a number of days without water. Most of it is also due to the series of droughts that the country has suffered over a couple of years. So our water bodies have not really been storing much water, so that has exposed people to the cholera outbreak. Also, in some of the communities, we have a lot of overcrowding there, and because the cities in their initial design, they were not designed to accommodate large numbers of people, so that has also put pressure as well on the services to be delivered, and also on some of the amenities. For instance, we've been seeing a lot of sewer pipes bursting in the communities, and because also of the current economic climate, the local authorities have been struggling to meet their service delivery obligations. I think that has been the major challenge, coupled with our ailing health sector as well, that has been struggling to also respond to some of the health emergencies in the country. I think in a nutshell, I would attribute it to that.
Okay. Now, Beatrice, we've seen that lack of access to clean water and sanitation are some of the reasons that have exacerbated the outbreak. Why is there still that issue in Zimbabwe up until this moment?
At the moment, the government is working tirelessly to make sure that we have got water in all the wards, all the villages. But it's not something that can be done overnight. You know, the ground is very dry. We've had, like the other speaker said, we've had drought for several years. Now for our boreholes to get hold of water, they have to go 90 to 100 meters, and it's not very easy for the government to make sure that 1,900, more than 1,900 wards get water in every village, where you find in one ward there are maybe 52, 54 villages. The government, for me, is trying very hard, is trying outright to make sure that each ward, each village get water.
Okay. Now, Sibusiso. Okay, go ahead, please.
And also in the areas that have been affected, because it's not the whole country at the moment, there are areas that have been affected by cholera. And in those areas, the Minister of Health, together working with the Minister of Local Government and of Water, they've been working together to make sure that in these places they get adequate bowls and adequate water to eradicate this cholera that is affected in those areas.
All right. Now, Sibusiso, if we're talking about the reason for the prevalence of cholera, I think some people would like to mention that there are also socio-economic factors that come to play. Would you agree with that?
Yes, I would. And for me, this is how it plays out. So for the local authorities or for the government to be able to provide some of these services, the services come at a cost. And naturally, the government would rely on maybe taxes for them to be able to mobilize some of the resources. In the case of local authorities, they rely on the residents being able to pay their rates on time so that they can be able to also offer quality services. Now, because of the socio-economic issues, like earlier on, I did say that there's been an increase in rural to urban migration, which has seen an increase in the number of people living in the cities, which has also brought pressure on the currently available services on offer. At the same time, because of issues of unemployment, because of an ailing economy, a lot of the residents are not able to effectively pay their rates or their bills on time. And this has continued to sort of like cripple service delivery within the country. Of course, we do have our political situation as well, and we've been in an election mode for quite a while now, and that has its own dynamic and contributions to the socio-economic situation that's happening in Zimbabwe. But I would reiterate that where people are able to pay for the services, where people are able to pay for their bills on time, the authorities are then able to meet some of if not most of the service delivery obligations. So if we could also probably improve the economic situation or the unemployment situation, particularly amongst the productive age group, which is young people, who are the ones who are moving mostly from the rural areas to the urban areas to try and earn a living. We should see a bit of improvement, even in cases where the poles are there. Sometimes, particularly women, children, and girls have to walk longer distances to fetch the water. It also exposes them to other threats like sexual gender-based violence as well, as they try to get water. So it compounds the challenges that the vulnerable people then face moving forward.
All right. Now, Beatrice, finally, what would you say that over time have proven to be the most effective strategies for containing and preventing the spread of cholera?
Thank you. I think this issue that the government is running with to make sure that there is adequate water everywhere and adequate water closer to where people stay, to avoid them walking long distances to fetch water, and also to make sure that the issue of litter in urban areas, sometimes things like that, it's not only the government that has to work on that. It also needs us people to work together and complement our government, our councils, by making sure that we stop littering all over. Because for me, it's the issues of debt that has contributed. Because as you can see that in the deep rural areas, you don't find cholera, but within the growth point where you find people littering all over. So it's the issue of Ministry of Water, Ministry of Environment, and us people living in those areas to work together and combat this issue of littering. And also together with the Ministry of Health, that is trying so hard to make sure that those affected are getting treated. And also those not affected and those not the areas that are not affected as well, to prevent by making sure that there is cleanliness. That's why you find that our president has introduced this issue of cleaning every week. You find that he's cleaning somewhere with people of that area to make sure that the people, when he goes, the people of those areas remain cleaning their areas every week, if not every day, so that we have total cleanliness where we are staying.
All right. Thank you very much to both my guests, Sibusiso Bhebhe, Executive Director, Youth Zimbabwe in Bulawayo. And of course, thank you so much to Biata Beatrice Nyamupinga, also in Zimbabwe, the member of Zimbabwe Parliament, Goromonzi West Constituency. Thank you both for being a part of the program today and for shining the light on ways to prevent the spread of cholera in Zimbabwe. And we do hope that these means and measures that have been suggested would actually go a long way to helping as well. Well, this has been Village Square Africa. Thank you so much for watching. Stay tuned as we bring you more episodes where we discuss issues as it pertains to the African continent. And also stay with us. The news comes up next. I'm Blessings Mosugu, and it has been VSA.